Hello everyone, I'm Dr. Prateek Joshi. Today we have a case of a young gentleman who sustained twisting injury to his right knee joint 1 month back. He was found to be having complete ACL tear on MRI and on diagnostic arthroscopy. As you can see, I am seeing through the anterolateral portal of the knee, and I have inserted my probe from the anteromedial portal. There is complete tear of the ACL, and what you are seeing is a torn ACL stump which we are going to excise in order to start the procedure of arthroscopic ACL reconstruction. So as you can see, I am cutting through the ACL stump from the tibial end, and I am going to take it out with the arthroscopic grabber. So now we have a clear picture of intercondylar notch. I am going to use arthroscopic shaver to clean up the tibial stump of the ACL, and then I am going to create a good vision to complete the arthroscopic ACL reconstruction surgery. We need to remove the fat pad for us to have a better vision all around the intercondylar notch. So what you are seeing is I am using arthroscopic punch to remove remnant ACL tissue from the femoral side. So this step is important to identify the femoral ACL footprint. Unless we understand where exactly is the femoral ACL footprint, it will be difficult to do anatomical ACL reconstruction surgery. So as you can see, I am using arthroscopic punch and arthroscopic shaver to identify the femoral footprint. So now I have inserted the femoral amer through the anteromedial portal, which is 7 mm offset, and I am going to use guide wire through the femoral amer to drill the guide wire from the lateral femoral condyle. So as you can see, I have drilled the guide wire through the femoral ACL footprint through the lateral femoral condyle. Now I am going to use endo button drill bit over the guide wire to drill over the lateral femoral condyle. So this is going to create our femoral tunnel for the ACL. So on the endo button drill bit, there are laser marks by which we should be able to have provisional idea about the length of the femoral tunnel. So in this case, it's somewhere between 40 to 45. So now I'm going to use a depth gauge to know exactly what is the length of our femoral tunnel. So in this case, it is 43 millimeter. So I have inserted my guide wire again, and I'm going to drill with 8 millimeter femoral drill bit because the diameter of our graft is 8 millimeter at femoral end. So as you can see, I'm drilling up to mark of around 30, and that is going to be our femoral tunnel. So this completes drilling of the femoral tunnel. We should be careful to incorporate the soft tissue which are in front of the mouth of the femoral tunnel. And now I am going to drill our tibial tunnel, for which I am going to insert the guide wire from the tibia by using the ACL tibial jig. So the jig should be placed in such a way that the guide wire exits just posterior and medial to the anterior horn of the lateral meniscus. So this is perfect position of our guide wire, on top of which I have drilled with 9 millimeter drill bit because the diameter of our graft at tibial end is 9 millimeter. So now I have passed the graft through the tibial and the femoral tunnel with 25 mm continuous loop endo button attached to it, and fixed the graft at the tibial end with interference screw of dimension of 10 into 30 millimeter. So these are the post-operative X-rays. Thanks for watching this video.